afternoon, everyone. It's nice to see everyone here on such a beautiful summer day. My name is Roz McCormick, and I'm the Chief Operating Officer here at Auburn Memorial Hospital. And I'd like to welcome everyone to this great event as we partner with the American Cancer Society and Congressman Arcuri for a serious discussion on health care reform. I'd like to introduce the people that are here on stage. We have Colleen Campbell-Carter in the first seat here, who is a local resident and a small business owner. We have Congressman Arcuri. We have Lisa Smith, who is the Regional Vice President of the American Cancer Society. And we have John Barron, our Chief Financial Officer here at Auburn Memorial Hospital. Before we start the program, we do have a few housekeeping events or announcements. There are 2 exits in the back of the room, and there are restrooms back there also.
Can you just pick up the cordless mic and that probably work better for you?
And also, there is free parking today. So as you exit the garage, just let the attendant know that you were here and you won't be charged for parking. I would also like to, at this time, acknowledge some of the local officials who are here with us today. And I ask you to raise your hands. Michael Quill, who is the mayor of the city of Auburn. Cynthia Aikman, who is our Cuda County legislator. Thomas McNabb, an Auburn City Councilor. Daniel Larson, who is the president of Cuda Community College. Elaine Daly, who is the Cuda County Director of the Health and Human Services Department. Arthur Bellanzoni, who is chair of the Hospital Foundation's Planned and Leadership Giving Committee. Mark Kalish, who is our city manager. And Debbie McCormick, who is our city clerk. Thank you. I would now like to invite Mayor Quill to do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mayor Quill. It is now my pleasure to introduce Lisa Smith, who is the Regional Vice President for the American Cancer Society. Lisa has been with the American Cancer Society for over a decade and oversees programs and operations in the central and southern tier of New York State. For years, the American Cancer Society and Auburn Memorial Hospital have been partners in the fight against cancer. We have hosted American Cancer Society patient support programs on site for many, many years, including the I Can Cope and Look Good, Feel Better programs. We are both partners in the Cancer Services Program in Cuda County, where we have been able to provide cancer screening to uninsured and underinsured residents of our county. Auburn Memorial Hospital is pleased to face the challenge of healthcare reform with the American Cancer Society and look forward to the day when affordable health care is within the reach of all of our residents. Thank you, Lisa.
Thank you, Roz, and thank you for hosting this today. Thank you all for being here, and special thanks for Congressman Arcuri for putting this together. You know, as Roz said, I've been doing this for a decade. That seems like a really long time put in that perspective. And I'm here today. The American Cancer Society, of course, fights cancers on many, many fronts. And we help many patients, and we do a lot of research and have local services, education, and really push for prevention of disease. But today, my real role here is to represent all the patients that are going bankrupt or are losing their homes or are making tough decisions that they shouldn't have to make because they don't have affordable health insurance or have co-pays that are too high. And those are the people that we want to, they're the unsung people that we don't hear from all the time. And my role here today is really to represent them. It's like people like Lee, who we knew very, very well, who although she took care of her children, she was a single mom, had 2 boys, always took care of her kids. They had their wellness checkups, they got their vaccinations. But by the time she actually went to the doctor for her first time in years and years and years, her cancer was so advanced, stage 4 cancer, they couldn't do anything for her, and she's no longer with us. And it was because she did not have affordable health insurance. And we all know people like this. You know, this is not an issue just about us. It's not about how our insurance is or how it's affecting us. It's how it's affecting everyone in our communities, because that's the kind of people that we all are. We have built our communities. The Auburn community has always been completely for each other, and it's something that neighborhood feel of small town communities like ours is really important. And I think that's why everyone's here today, because you all have your own thoughts and feelings, and not that this is easy at all. And the answer is not going to be easy, but having dialogue like this is going to be so very helpful. So for us, we're really trying to focus on, you know, how can we help people like Lee, like Diana, who had no insurance and couldn't, although she had breast cancer and was able to get her surgery covered and her oncologist, her chemotherapy covered, she could not find a plastic surgeon that would accept Medicaid to do reconstructive surgery. Can you imagine? She could not get reconstructive surgery, and this is happening right here in our own communities, and we need to stop that. We need to find the answers. And I do have a script that I'm completely going off of, so I apologize. Almost half of the uninsured cancer patients use up most of their savings fighting their disease, over half. And those are the people that have no insurance. But in addition, 1 in every 5 patients who have insurance will face financial ruin in their battle with cancer. High costs coupled with inadequate insurance policies cause nearly 1/3 of patients to delay or outright skip treatments for their disease. We believe that greater access to care achieved through comprehensive health care reform legislation must be a top priority in 2009. Right now, the bills in Congress represent significant progress over the status quo, and I hope we've made a clear case that the status quo when it comes to cancer is not acceptable. The House bill does much to help people prevent cancer or fight cancer should they be diagnosed. Strong provisions include the elimination of pre-existing condition clause, no co-pays for preventative screenings, and the end of arbitrary or lifetime caps, which many cancer patients can run up against in a short time. And imagine if your daughter, who has been fighting cancer since she was 3 and is now 11, has hit the cap, and a new standard of treatment comes out and you cannot afford to get it because you've hit your cap and you have no more money left. And again, this is happening right here in our community. These bills are not perfect, and the American Cancer Society believes more must be done to ensure the families are not bankrupt by a cancer diagnosis. We believe that a more reasonable limit must be set on a family's out-of-pocket expenses so patients can focus on life-saving care without losing their life savings. There are other improvements that must be made for this legislation to truly meet the needs of our most vulnerable citizens. The negotiations must continue in Washington for these improvements to be made. I know there's no simple solution, but I do know that honest, open, productive dialogues such as these are what will help us make decisions. Surely, if one person can fight cancer, then our entire nation can rise up to conquer it once and for all. We won't rest until we know that we have ensured that every man, woman, and child in this nation has an equal chance in fighting cancer. I'm happy to introduce a very special guest today, Colleen Campbell Carter. who is a longtime volunteer for the American Cancer Society here in Cayuga County. While she has dedicated herself to the needs of helping others who are facing cancer, Colleen has had to face her very own difficult challenges in getting health care she needs as an uninsured consumer. Colleen is here today to share her story as a way to remind us that behind every statistic and news article is a real person whose future depends on the outcome of health care reform. Colleen.
Today I would like to share my experience of being without health insurance. Perhaps some of you in the audience can relate, or maybe you cannot. We all need to understand the problems that are associated with being uninsured so we can fix the problems that exist and make the system work better for everyone. I've been a licensed cosmetologist for 27 years. I own a salon in Union Springs, New York, and I'm a longtime volunteer for the American Cancer Society's Look Good, Feel Better program here at Auburn Memorial Hospital. Look Good, Feel Better pairs cancer patients with cosmetologists who in turn help them temporarily exchange the challenges of treatment for a little pampering. In my experience, I have seen firsthand what cancer can do to a person. Last year, I personally came face to face with the possibility of having cancer myself. Being self-employed as a business owner, I am unable to receive health benefits through my job. For several years, I was able to take advantage of the Family Health Plus through the state of New York. 2 years ago, I got married, and our combined income put us over the limit income for Family Health Plus by just a few $1,000s a year. I was eligible for limited family planning coverage through New York State Medicaid program. However, I was not worried. I assumed I would be covered under my husband's health benefits through his employer. We then found out the premium to add me to his plan would be $100 a week. At that point, we were unable to afford the extra $400 a month. That was when I realized I was working full-time, married, and I was going to have to go without health insurance. That's when my health problems began to arise. I had developed constant bleeding and other symptoms that were consistent with those with ovarian cancer. For nearly a year, the symptoms continued until I finally became so ill that I developed anemia. I spent several anxious weeks filling out paperwork and waiting for an appointment for a sonogram. I knew I had to pay for it, and every form I had to sign along the way reminded me of that. The test came, excuse me. The test came back normal, but still did not explain the cause of the constant bleeding. That is when the doctor ordered a biopsy. The American Cancer Society helped me navigate this journey by helping me find doctors who would see me and figure out what I needed to do next. Fortunately, that family planning coverage, after weeks of investigating, would cover the biopsy. The doctor who does this procedure only came into the office once a month, and I had to wait weeks for an appointment, and an excruciating 6-week wait for the results of the test. The pain of not knowing the diagnosis was excruciating in itself, not to mention the fact that I was still suffering with the actual medical problems. However, after the longest 6 weeks of my life, I learned that I was, in fact, cancer-free. Unfortunately, my story does not end there. Being uninsured causes somewhat of a chain of reaction to future problems. While I was relieved at my diagnosis, I clearly still had some sort of problem that needed to be solved. A repeat sonogram was recommended to follow the progress of my condition, but I had to refuse the test because I could not afford it. An adjustment to my medication has helped, and it is covered under my family planning coverage, but a further follow-up is out of the question right now. I am still unable to enroll in a normal health insurance plan simply because I can't afford it. What I remember most about my experience was the waiting, the stress, the anxiety of not knowing if I was living with cancer, and every day I worried that I may always be without health care. What is worse is that I'm not alone. Some 47 million Americans are also without health insurance as we speak. I hope that a solution is found soon. Our country cannot afford to be without health insurance. Thank you.
It's my privilege now to introduce Michael Arcuri, representing New York's 24th Congressional District in the U.S. House of Representatives. Congressman Arcuri was born and raised in Utica, New York, and still lives there with his wife Sabrina and their 3 children. Congressman Arcuri received his undergraduate degree from SUNY Albany and his law degree from New York Law School in New York City. Prior to being elected to Congress, Mr. Arcuri served as district attorney in Oneida County for 13 years. Since taking office in January of 2007, the congressman has been especially focused on the needs of families, small businesses, seniors, veterans, and farmers of upstate New York. He serves on the House Transportation and Infrastructure Committee and the House Rules Committee, where he works to bring resources back to upstate New York to build the local economy and create job opportunities. Congressman Arcuri's record shows his commitment to healthcare issues, and in particular, the needs of cancer patients. He voted in favor of the Family Smoking Prevention and Tobacco Control Act this year, which was signed into law by the President on June 22nd, and finally puts the manufacturing and marketing practices of the tobacco industry under the jurisdiction of the Food and Drug Administration. He voted in favor of the National Pain Care Act earlier this year. The congressman has also co-sponsored several pieces of legislation that would help improve access to life-saving cancer screening, including the Colorectal Cancer Prevention, Early Detection and Treatment Act. Finally, his support of efforts to boost research funding for the National Cancer Institute, the largest funder of cancer research in the country, was instrumental in seeking federal support for cancer research increased for the first time in half a decade. Welcome, Congressman Arcuri.
Well, thank you all very much for being here. I want to say thank you to Auburn Hospital and the American Cancer Society for putting this together. And most of all, I'd like to say thank you to Colleen for sharing her story with us. You know, I often say that I represent 650,000 people in the district, but that really is 650,000 stories, and everybody has a story to tell about healthcare, and certainly I don't think any are more poignant than Colleen's, and that's the reason that I actually have town hall meetings, so I can hear stories like that to bring back, because those are so important in terms of what ultimately the decision that I will make on the healthcare bill. Just to give you some background, we've done, I think this is the 4th town hall meeting that I have done, plus we've done probably 20 or 30 meetings with smaller groups. We've tried to meet with people in every way. Some people want to meet one-on-one, face-to-face. Some people want to meet in groups, and then we've tried to do these. We've even done a couple teletown hall meetings where we've had 3,000 or 4,000 people. On one call, we had actually 7,000 people to talk about healthcare. So we've tried to get out and get as much information. And I just want to say before we open this up to comments is, you know, I was one of the people that fought really hard to not take a vote on the healthcare bill before August, and I felt very strongly about that. And the reason I felt so strongly about that is, number one, I wanted to have time to finish getting through the bill, which is pretty lengthy. But secondarily, because I felt it was very important for me to come home and hear the stories and hear from the people. And you know, I hear people ask me, "Are you still doing town hall meetings?" And they're not always pleasant. You know, in fact, yesterday I met with a group, and it got a little bit going, let's say. But I think that's really important because I need to hear the passions. And I said this, we had a big town hall meeting in Utica. There were almost 500 people there, and I said, look, I'm one of the people that has not made a decision yet. I am not sure what I'm going to do. I know that we need healthcare reform. I know the system is unsustainable, but I need to be convinced, one, that we can afford it, and that the bill is right in terms of the pay for, and number two, that it's the right bill. We have to resist letting this be political on either side. We have to vote for healthcare because it improves our healthcare system, not because it advances either side's political agenda, and that's really what ultimately I will be looking for. So I continue to strongly support healthcare. I think we need reform. I want to be sure that the bill that I vote for is the very best bill that we can, and I said this in Utica, there's no use, I want to hear your passion, but there's no use yelling at me because I'm, again, one of the people who is undecided and is going to make a decision. So I want to hear your thoughts, your passions, and your feelings, and your stories, because that will really help me in terms of of making a decision. I don't have all the answers. I'm not here to defend the bill, but I am here to hear what you have to say. So with that, I'd just like to open it up, and please raise your hand. And, I'm not sure.
There's a wireless mic.
Okay. Oh, okay. There we go.
Can I just say first, they gave me the job as moderator. That means I'm in charge, and I always like to be in charge, so I appreciate the opportunity. We are going to take questions. If you'd raise your hand, we do have mics that will come, the staff will come over to you and give you the mic. We ask that you keep your questions to 2 minutes and ask that everyone wait until the question is asked and answered. I think everyone's comments are extremely important, and we want to make sure we get everyone in. So that being said, we have some people right here.
Each week I called your office, Representative Arcuri, asking for a time when the town meeting would be. I did not hear a date until last Friday when I called your office. It was closed. I called Washington, D.C. He did not know, but he referred me to your Rome office. And the fellow there said there would be a town meeting to be held at Community College. All people could come. They would have bigger offices and so forth. He recommended I call Sharon at American Cancer Society. She said it was moved to Auburn Memorial Hospital as they didn't want loud noise or railing. She said it would be quieter environment and it was invitation only. I asked how I could come. She said, I'll take your name. And I appreciate that. I am a cancer survivor. My husband had Alzheimer's disease for 13.5 years before he died. Fortunately, we were savers. We did have good insurance. I had no problem with Blue Cross Blue Shield all of those years. We had everything we want. I did not choose reconstructive surgery, and I'm fine with it. I think we can all get along without that. That's a personal thing. What I'd like to know from you, how can you justify cutting $500 million from Medicare and Medicare Advantage without trying to cut the fraud and improving the existing programs before going to another government-run program? I think we could take care of these catastrophic illnesses and other things. I do not agree that we should have to insure illegal aliens. There's parts of it I really am against. Thank you.
Well, first off, let me answer the last part first. With respect to illegal aliens, there is no provision in there that says that we will cover illegal aliens. In fact, it specifically says that they will not be covered. Okay, so and that's page 143. If you ever get an opportunity to look at the bill, it's pretty clear on that page. Secondly, with respect to cutting Medicare, look, Medicare, I think from what I hear from my constituents, is probably the last thing that we ever want to cut. In fact, to give you an idea, it was interesting, in the last day of Congress, the committee that oversees, one of the committees that oversees this is the Energy and Commerce, the one writing the bill. And there was an amendment offered to cut the largest entitlement program for health care that the government runs, and that's Medicare. And that failed unanimously. So there wasn't a single person in the Energy and Commerce Committee on either side of the aisle that voted for that. So I think there's a very strong sense that Medicare works. I mean, obviously, it works well. We need to fund it a little better, and I think we always need to look at cutting waste, fraud, and abuse out of any sector of the government. But you know, we have to be careful in terms of what we're cutting. I mean, and this is the thing, and I don't have an answer to this, but this is the thing that always concerns me. So they say we're going to cut fraud, waste, and abuse, okay? Does that mean we're going to require doctors to give less tests? Well, I don't know. I mean, should they not give an unnecessary test? Should doctors not have to practice defensive medicine? Well, any doctor I talk to tells me the last thing we want to do is practice defensive medicine, which means sometimes we give tests that we're not sure if we really need. Those are the kind of things I think when we talk about improving the system that we need to work on. One of the big concerns we have, and I got to tell you, this is the thing. I happen to be a blue dog Democrat. That's the Democrats who are moderate to conservative. And everyone thinks it's because that we have been some of the ones that have been a little more hesitant about supporting the bill. And a lot of people think it's because we're moderate or conservative. Actually, it's not. It's because most of us represent rural districts, like I represent. And the thing we have to be most concerned, I think, what I have to be most concerned about is what this bill will do to districts like ours, to rural districts. To give you, for instance, we're talking about a public option, all right? I support a public option. The original proposal in a public option said that the public option would be funded at the Medicare rate plus 5%. Well, the problem with that is making it extremely difficult for our providers because it's not giving them, I mean, we continue to lose providers because such a high number of the people in our district are Medicare recipients. So what we needed to do and what the Blue Dogs put in the amendment was we should make the pay for what they call the Medicare rate plus. In other words, keep it negotiable by the provider. So if a provider can get 10% or 15% and that passes in an area, well, that's good because that'll help us keep our doctors in our rural area. I heard an interesting statistic. In New York City, the number of doctors per 100,000 is, I think, 375. In our district, in our area, it's about 65. All right. We continue to lose, and I don't think we're unique. I mean, it's interesting because everyone talks about New York, and I say, wait a minute. When you talk about New York, upstate New York's a lot more like Iowa than it is like New York City. And you know, I mean, if you look at Iowa, there's big cities, small cities, and a lot of rural area. And it's funny because I end up being in the same place as many of the Iowa representatives when it comes to issues like this. So I agree with you in terms of we have to be careful what we cut and how we cut. We need, you know, and I can tell you I'm a former DA, you have to always be looking at, you know, waste, fraud, and abuse. But you know, waste, fraud, and abuse doesn't just come on the bottom scale, it comes on the top scale, it comes from all different areas. And we need to take away the incentive. I look to it, and this is easier said than done, but we need to take away incentives for doctors to propose, to do defensive medicine. And you know, those are some of the things that we also need to look at. So I don't know if I've answered your question, but I want to assure you that I share your concern in terms of how we cut, because if we're not careful how we're cutting, we're really doing the exact opposite of what we want to do, and that is try to get doctors into our rural areas.
How about tort reform?
Well, I can tell you that I'm an attorney, and I've practiced law. I have been sued because I was a DA. I've been sued for malpractice more than probably every doctor in this hospital. So no one understands frivolous lawsuits more than me. But I want to say this. I am concerned about one thing. I don't like the idea of putting arbitrary limits on the amount of money that a person could recover. Because if my daughter is injured as a result of the negligence of a doctor, I don't think that any group, that they should pass a law that arbitrarily sets what her pain and suffering. Now, if you want to talk about putting sanctions on attorneys that bring frivolous lawsuits, I will be there. And I think that will, because I can tell you what happens. The insurance companies settle the frivolous lawsuits for what they call nuisance value. 20,000, it used to be, when I practiced law, it used to be 10,000. Now nuisance value is about 30, 40, 50,000, depending on the suit. So I think that that's a direction that we need to go in. We probably won't address it in this bill, but I think it's it may come up. It may come up when we get the Senate version back. I don't know that it'll come up. It's not in the House bill. It may be in the Senate bill, and I don't know what will happen in conference. But again, and I said this again yesterday. I talked to a group of doctors that don't forget that, and they were trying to draw this New York relationship, and I said, well, don't forget, it's a heck of a lot easier to get a malpractice verdict out of the Bronx than it is, I'm not sure about Puyallup County, but I know about Herkimer and Oneida County, where I used to practice, where there's a lot of insurance companies, and it's very hard to get a malpractice verdict. So, you know, things vary, but I think we need to look at sanctioning attorneys for bringing frivolous lawsuits. I think that would go a long way. Okay.
This gentleman here.
I don't know if there's anything left. She asked just about everything. She got it.
Well, thank you for having this meeting. On page 16, section 102A, the bill pays lip service to allowing individuals to remain in the grandfathered private plans. But the requirements to qualify for the grandfathering are so stringent, they will soon force individuals into the government-run health plan. As soon as anything changes in the plan, such as a change in copay or deductibles, or even added benefits or coverage of a new life-saving drug or treatment, which many insurers change each year, You will be forced out of that coverage and be forced into a government-approved qualified plan instead. This is page 16, section 102A. On pages 116 through 128, sections 221 through 225, the House Democrats' bill establishes a new government-run health plan according to nonpartisan actuaries at the Lewin Group, that's Lewin, would cause as many as 114 million Americans to lose their existing coverage. Moving these Americans from their current plan into a government-run plan violates the president's oft-stated promise that if you like your current coverage, you can keep it. Both the Associated Press and the ABC News have already debunked this pledge, noting that White House officials have acknowledged the president's rhetoric shouldn't be taken literally. Your comments?
I disagree with you on page 16. We read that with your interpretation of page 16, and I can tell you, not that, and that's one problem I have with page 16 is, I'm an attorney, I read it 5 or 6 times because I had this question. I had another attorney in the office, he read it 5 or 6 times. We came up with we came up with 2 different interpretations of what it means. I don't necessarily agree with your interpretation. I think you're allowed to be grandfathered in, and but I don't think that if anything changes, that you are forced into the public option plan. What 16 says, what I think 16 says, although there's a problem, and obviously there's different interpretations, but I think that what is intended in 16 is that if there is a change, you have the option of getting into the public option, but you do not have to. Okay, I don't think it necessitates it. I think you can though.
And I would hope that whether you're for or against this government-run plan, that at least we can all agree that people should have the choice of keeping their existing coverage if they like it. I currently like mine. 10 years ago, I had arthroscopic surgery on my left knee with Cigna. I had no problem with them. Didn't have to wait. I was able to go to 2 different doctors until I finally felt comfortable with the third doctor that I talked with. And they gave me no problems. I paid the deductible. They paid everything without any question.
So you bring up, I think, the most important point, or certainly one of the most for me, is that we should not be forcing people to leave their plan, nor creating pathways for them to have to leave their policy, their plan that they have. If you like your plan, you're happy with it, you should be able to keep it. And I think one of my problems with the bill is the ambiguity that some pages, like page 16, have. And clearly that's one of the things that I would like cleaned up in the language so that we can be that everyone can be absolutely certain what page 16 means. But I could not agree with you more. If you like your plan, you should not be required to change it. Thank you.
We have a lady here who's next.
I don't know how many people have read the bill, but I want to mention a few things here they may not be aware of. On page 851, home visitation programs for families with young children and families expecting children. And this is for a period of 2010 to 2014. Now, my mom had 7 children all at home, and she didn't need anybody to come to the house. $750 million. Prevention and wellness, the rest of these are for a 10-year period, $35.3 billion. Preventive task force, $350 million. Prevention and wellness research, $2.74 billion. Delivery of community preventive and wellness services, $17.2 billion. Core public health infrastructure and activities for state and local health departments, $13.6 billion. For carrying out core public health infrastructure and activities, $4 billion. Interdisciplinary training programs, advisory committee on health workforce evaluation and assessment, and health force assessment, $1.149 billion. Community health centers, $38.8 billion. Now, also in this plan, they are offering scholarships, It's grants and contracts accepted for enrollment at an accredited graduate school or program for nursing, health administration, management or policy, preventive medicine, laboratory science, veterinary medicine, or dental medicine. And there are also grants for physicians. Grants for contracts also for cultural and linguistic competency training. Now, in this bill, there are a lot of unknowns specified by the commissioner. The commissioner shall establish rules and procedures. The commissioner may specify rules of the commissioner, standards established by the commissioner. If the commissioner deems appropriate, as defined by the commissioner, determined again by the commissioner, and the commissioner establishes. And we've got a whole bunch of these that we don't really know what all they're going to be doing. And then the secretary gets in on this as well. The secretary has the authority to stop taking applications for participation in the program. This is a certain program, and evidently they're limiting the number of people in that. The penalties, oh my goodness. The penalties charged employers shall be deposited as miscellaneous receipts in the Treasury of the United States. It has many penalties. Penalties also for hospitals, physicians, if they don't adhere to the policies or get the paperwork in on time and all that kind of thing. After going through this bill, I think it needs to be put in the paper shredder. Now, this woman that spoke earlier, yes, there are some people that do need assistance, but most of us have good health care and we don't want to lose it. And if the government takes control, we will. And then we also have to look at what happened with General Motors and Chrysler. What was one of the things they did? They closed down dealerships, put people out of work. Is this what the government's going to do? If they have X number of hospitals in a certain area, are they going to close those down as well? As I said, it belongs in the paper shred. Thank you.
Well, ma'am, thank you for your comment. I mean, I don't know where to start, but let me start first off with closing hospitals. It's the exact opposite. In fact, you talked about creating money being in the bill for healthcare facilities, for community healthcare facilities. I mean, obviously what we're trying to do is bring healthcare to more communities, especially the rural communities, as I expressed earlier. But you talked a whole lot about preventative care. I have to tell you, the money that you talked about being in there for preventative care, one of my problems is I don't think that's enough, because let me tell you why. Anybody you talk to, from doctor to healthcare professional, will tell you if you want to save money in the healthcare system, put money into preventative medicine, because what you save on the front end dramatically saves the long. If you allow a woman to get a mammogram every year and you pay for it, it's going to reduce the amount of breast cancer. If I can give you a personal story about a test that my insurance company denied that would have that I ended up paying for, but was critically important. Because my wife carries a chromosome, so you have to be careful if you have children that if I carry the chromosome as well, we'll have a child with a very, very rare disease. So those are the kind of tests, the preventative medicine that we should be paying for, that we don't always pay for. All right, and I can go on and on. I mean, doctors should be rewarded for taking a patient and working with their patient's diet, and a general practitioner working with their diet to reduce their cholesterol before they put them on Lipitor. Those are the kind of things that I think we should be looking at when we talk about preventative medicine. You talked about home health care. I just did a home health care visit this week, and there was an individual who just had heart surgery. They put the machinery in his home, and his wife every day gave him the visiting nurse came on the other end of the computer. They tested his blood pressure, they tested his heartbeat, they tested his lungs. They went through all of it. That piece of equipment, when they bought it in 1997, was $10,000. Do you know how much it saves the system because this individual doesn't have to go into his doctor's office once a week? And when a couple of times when they wanted to call 911, instead they called, they put him on the monitor and they said, you know, he's okay, you don't need to take him to the hospital. In fact, while we were there filming it, his blood pressure was high and they said it's naturally high, you have a lot of people, you're on camera, it's what we would expect, we'll test it again in another hour and see if it's brought down. Those are exactly the kind of things that we should be incentivizing in the bill. The other thing, you talk to doctors, you talk to any healthcare professionals, and they say, we need to really be incentivizing general practitioners. Because instead of people always going to their specialist to get tested, we need to have people working through general problems with their family doctors, with their general practitioners. So the money that we spend there is critical. Lastly, with respect to scholarships, that's the one thing most everyone agrees upon. When we want to incentivize getting doctors into high-need areas, not just urban areas, but rural areas as well. And the best way to do that is to incentivize it by loan programs. Everywhere in the world, they do similar kinds of projects. I think that's critically important, especially in areas like mine. And you talked about the secretary. One of the provisions in that bill says that the secretary, you can make application to the secretary to determine that your area is in fact a high-risk area, or a high-need area, I should say, and the secretary can establish your area as a high-need area. I can tell you, there's a place in my district called Norwich that's not deemed to be a high-need area, although they have very few doctors, and they lose doctors to other areas. They should be designated as a high-need area because it's a rural region. Those are the kind of things that we need to have we need to have ability to petition the secretary to designate different areas, especially we need it more than any other place, rural areas, as high-need areas, so it's easier to incentivize getting doctors and healthcare professionals in our areas. So, you know, there are a lot of things in the bill that are complicated, but the things that you talked about, and some of them, you know, are probably unnecessary, but the things that you talked about are the things that I think are most important to this bill: the preventative care, the home health care bill, incentivizing getting doctors into high-need areas and healthcare professionals. So, you know, I disagree with you with respect to the areas that you quoted, because I just think that's part of what we need to do if we're going to have comprehensive healthcare reform in this country.
With the government, the company has to make some profit. The post office doesn't make any profit, even though the president said it can compete with UPS. Army Corps of Engineers, Medicare, none of those. Social Security was set up originally to be just for retirement. It's not. All through the years, people have added things. Why can't we make what we have now, with all like tort reform, different other situations, to make what we have now acceptable, instead of trying to push these bills, both Senate and House bills, through without really people not knowing anything about them. The president talked about transparency. The only transparency I see is, I'm going to force this stuff through you before you can even make a whimper. All the bills that they're putting through, the cap and trade, different things like that, nobody's had time to read them. Most of the senators and representatives haven't read it. I tried to get a hold of Mr. Schumer for 3 weeks, 3 hours a day. Couldn't get a hold of him, I got a hold of your office. But the point being is, they're trying to ram things through us.
I'll take that as a compliment. One part of it.
I said that for them. That's what I said it for. One other thing. I just moved here from Chicago. I retired about 2.5 years ago. I live in Kings Ferry. I think it's the best kept secret of all New York State. One point though, my house in Chicago, 5-bedroom house in the western suburbs. My taxes for my little log house are 4 times what my house in Chicago is. And I don't get a dime. There's no water, except I use the lake. I'm right on the lake. There's no sewage, there's no plumbing, there's nothing that the county gives me. But they charge me 4 times as much. That's it.
Okay. Well, let me start with the last thing. I'm here to gladly take all the heat you can give me on healthcare, but on local property taxes, you're on your own on that one. I'll let that. All right. Secondly, I think you brought up some very, very good points. I mean, obviously, and I mean this, one of the reasons that I fought so hard in my position with respect to the leadership, and I told the House leadership, I don't care what the bill says, it doesn't matter to me. If the vote comes up before August 1st, before I get a chance to go home and talk to my constituents about it, I'm voting no. I mean, there's just no ifs, ands, or buts about it, because I think that you're right, we need a degree of transparency. That's exactly what we're doing. I mean, the bill has been out. Well, I mean, you certainly have an opportunity to read it, and as much as I have an opportunity to read it because it's online. So, I mean, and you certainly can turn on any news show and hear it over and over again, whether it's Meet the Press on Sunday or one of the nightly talk shows. So we're trying to get. I mean, that was part of what I think. And when I go back, I'm still not sure how I'm going to vote, but I know one thing: I certainly will have a much better sense from my constituents as to where they are and what their feeling is with respect to health care. And secondly is the idea, you talked, and I think the most important point that you made was with respect to insurance companies and how do we get them to compete. And that's an important point. Well, you say they can't, but I hear this from, I mean, I know about as much about it as you do, but I talk to a lot of insurance companies. I talk to, I'm there, and I got to tell you one other point. I represent a lot of insurance companies. I represent Excellus Blue Cross Blue Shield that employs 400 people in my district. And don't forget, they remind me on a very regular basis that they employ 400 people in my district, But nonetheless, I think they can compete. And they talk about the fact that they're they're not for profit, and they talk about their rate of return. They say that they're 88% they pay into their cash reserves and into their claims. That means that their administrative margin is 12%. So can they compete? And they say, look, it's only 12%. And I said to them, well, what's 1% equal? I mean, so if you take 1% off, does that make you competitive? I'm not sure. The private sector always tells me we can always do better than the federal government. Well, now's their opportunity. If we do this public option the way it's supposed to be done, I'm not sure that we can, but if we do it the way it's supposed to create competition. Now, let me tell you one more point that this may get me in trouble, but you talk about the post office. Well, the post office, that's true, probably doesn't function at a profit. But without the post office, what would UPS and FedEx be charging us if we didn't have the post office in there, which is really a very similar kind of concept to having the private compete. And I'll give you one more on the state level with, I'll let you respond. On the state level, we have a state insurance fund with respect to compensation insurance. And I represent the Hartford as well. And the Hartford Insurance does compensation work. And even though we have the state insurance fund that competes with them, they're still out there doing it. So, I mean, we have a model in New York where there is a public option that competes with the private sector that hasn't put the private sector out of business. And in fact, probably made the private sector do a better job in bringing its rates down, although I talk to most business people and they're not real happy with the compensation rates they pay.
But
Yes,
with
sir.
the bill that's on House and Senate bill, they would be fined if the people would leave. I mean, the thing is, no insurance company can make a profit against the government. And the post office argument, the post office has been losing money for 50 years, the Army Corps of Engineers. You look at any government agency, none of them make money. None of them even break even.
But
And you're throwing another health thing in, just like Medicare, which supposedly is gonna go broke in 5 years. Social Security, which is gonna go broke in another 7 years. So how can anybody, you can throw money into the argument all the time, but
that's not
nothing
what we're
ever
saying, though.
happens.
But that's not what we're saying. We're saying that we want to bring the cost of insurance premiums down with the competing insurance companies, because that's what we are. I mean, you could shake your head, but I mean that's what we're trying to achieve. Now, in my example with the post office is that the post office is probably responsible for UPS and FedEx having lower rates and not boosting their rates up, because if they do, people are going to send all their packages by the post office. So the concept is the same in terms of creating a cheaper model so that insurance companies have to compete. I mean, that's the concept. Now, whether or not it works is another story.
I'm sorry.
No,
That's what's in the bill, that, you have to, do this public option, and then to compete, the insurance companies will never be able to compete with the government. The government doesn't have to make money.
Well, I disagree with you there. I mean, because,
That's
I
the
mean,
bill is written, both of them.
no, actually, the Senate bill doesn't even contain a public option. So, just so you know, there's not a public option in the Senate bill.
There's an implication of a public option.
So, just so you know that, I mean, there's a big difference between the Senate bill and the House bill. So, I mean, I guess we're gonna move it along here, but, I think there's.
That's no fun.
Okay, we have the gentleman in blue back here. Do you still have a question?
Me?
Yes.
Yes, I do have a question. Could you tell me what the Lewin Group is? What is their function in the healthcare debate?
Honestly, I don't know what the Lewin Group is, so.
They're a wholly owned subsidiary of United Healthcare. They're not an independent actuary group, as this gentleman.
I don't have an answer to that, but I'll get you, so if you give your name to one of my staffers here, we'll get you some solid information. Can Jay, can you just get his name, or Nell, can you get his name and address, and we'll get him that information? I don't know if we need a microphone.
No, I think there was a gentleman back here that had his hand up first, yes. Yes.
Yeah. Well, thanks for having the meeting and the difficult, I appreciate the difficult situation that you're in with the healthcare.
Well, I certainly realize why we don't have healthcare reform, because it's not an easy, why it's taken so long. It's certainly not
This
easy.
gentleman over here, I would say it sure is nice going to our little Kingsbury post office, though, isn't it?
I think it's great.
I'd ask you to speak about two things. One is the insurance cartel, if you know anything about that. In other words, how is it seems if there was more of a competitive arena, that the marketplace would force down rates and would have better coverage. But the arena is so non-competitive that one of the CEOs has $700 million in stock options. They're able to afford that kind of luxury. $700 million would send tens of thousands of college kids to school. $700 million one person. The other thing I wanted to ask you about is what kind of lobbying contacts or what kind of pressure are you receiving from the health insurance industry in Washington? We know that there's, I believe, 6 lobbyists from the health insurance industry. Maybe somebody can correct me if I'm not right here, but I'm pretty sure this is true. For every member of Congress, there's 6 lobbyists for the health insurance industry. So I'm sure they're hunting you down on a regular basis.
You know, I have to tell you, I don't get a lot, especially in the past month. I mean, this thing has intensified, obviously, in the past 5 or 6 weeks. Most of the people that I talk to generally are at my request, and like the group that I talk to a great deal, the lobby group is what's called HANES, which is the Hospital Association of New York. And I have to say, the reason I like talking to them, and they come to my office pretty frequently, is they're pretty straight with me. And I ask them a question, and they tell me flat out, well, you know, this will hurt hospitals a little bit, but we can probably live with this. We would have a lot of trouble living with that. And I like talking to representatives like that that are honest with me, but I've gotten more information from the hospitals because I'm very concerned about our hospitals. I mean, if we, and that lady said that, the last thing we want out of this bill is to create an environment where hospitals are closing. We cannot have that. Just to give you, and I know this is not part of your question, but it's sort of a good segue, is that the New York State ranks 49 out of 50 in terms of profitability of our hospitals. Our hospitals are not for profit. But the problem with that is the average, and please correct me if I'm wrong, the average profit margin is about 1.4% throughout the state. In my congressional district, our congressional district, it's minus 6.5%. Our hospitals lose money. So it's critically important that whatever we do on this bill, we do, you know, it provides enough for the, and I worry about this because they say, okay, look, people will be insured in 2013, and at that point, hospitals are going to do much better because all the people that they take care of now who are uninsured are going to be insured, and they'll get that, you know, that reimbursement. The problem is that won't kick in full force until 2013, and we're going to cut off their what's called a dish payment. We're going to start to cut off their market basket payments this year. So, you know, the hospitals are saying, we got some trouble. Am I pretty much on board? We're going to have some trouble with our local hospitals. We have to be very careful of that. So I'm very concerned about that. So, I do hear from lobbyists, but I gotta tell you, I hear from much more than any lobbyist. I hear from the single payer advocates in my district much more frequently and, on a regular basis. So I would say it's balanced, and, when I have our district is half and half. I'm telling you, I mean, everywhere I go, every phone call we get, it's almost 50-50 in terms of people who support change and who oppose, the change. So in a sense, they have been beneficial to me. I mean, you take what a lobbyist says with a grain of salt. I mean, you know who they're representing. You take it, but sometimes you get a little bit of information relative to their position that helps out. In the same way, I'll sit with an insurance company, and you get information. I found out that Excellus Blue Cross has an 88% payout rate. I mean, that's good. That's good information to know. That's 12%. So it's important to sit with different people. It's important to know what the ramifications are for your district, one way or the other. But what's most important is these kind of things, hearing from the people.
And what about contributions? Have you received contributions from the health insurance?
I'm sure I have. I'm sure I have. I mean, and from individuals who are single payer supporters. I mean, I certainly have. It's across the board. So, in that sense, I'm uncommitted, and I'm uncommitted because I at this point, it's become real easy for me to vote. I'm not sure what I'm going to vote, but it'll be real easy because I know enough about it. The problem is, and I think President Johnson said this one time, it's not making the vote, it's knowing the right way to vote. I mean, that's going to be the real thing. It's here. Is this bill the right bill? Will the final bill be the kind of bill that improves health care in the way that we need it? I mean, this could end up being a vote like the Medicare vote was in the 60s or Social Security was in the 30s. I want to make sure that it's the right vote with respect to health care.
Okay, we're going to have this gentleman here, and then this lady here, and then this woman over here, and then we'll go back.
Yeah, I'm kind of disappointed because I'm sitting here listening to talk about, we haven't brought up cooperatives yet, but we've got single payer, we've got public option and so on. And it's all about insurance. I don't know that making insurance available really is going to make it affordable for everybody. Insurance companies are in business to make money. You know and I know, private industry would still be driving automobiles without seatbelts if it was up to General Motors. I think what we've got to do is cover everybody in this country with medical care, adequate medical care. It's a shame people in Cuba get better medical care than people here. It's a shame people in Canada, well, I shouldn't say that, my wife's a British subject. She has pretty good medical care when she goes back to Britain. Her relatives have pretty good medical care. They don't complain about it. They complain, but they don't complain like people here complain. You want adequate medical care, single payer, the government pays. Everybody is insured. That's the only way you're going to get reform here. And you know it, and I know it, and it's not that hard. It might be expensive. We might have to pay taxes like they pay in some of these countries that have socialized medicine. But we better go there, because otherwise we're leaving those 47 million people out there without insurance.
This woman right here, please.
Okay.
Actually, I'd also encourage anyone who hasn't said anything yet to please raise your hand, because there's a lot of people in this room, and I'm sure there's a lot of opinions. And I won't take long, because I had the privilege of talking with you a week ago in your office as a small group. But I do want to say what I said there in my last point, which is when it hasn't even been brought up today, which I thought some anti-Medicare people might bring up, which is the bill might mandate that we all buy insurance, every single person, and then it will subsidize those of us like myself. I live on under $25,000 a year, and so I'm sort of hoping I'd be one of those people that be subsidized. If we mandate everybody buy insurance, and then we mandate that we subsidize people like myself that don't make enough money, And we do not have a public option or, you know, a type of public plan that is affordable and that is nonprofit and that sets the bar for efficiency and good preventive care. In effect, we'll be just giving our tax dollars to insurance companies. And to me, it's like, why would you vote for a bill that just is a big tax boondoggle to private insurance companies? So I am really sure that we need health insurance, and I totally agree with the American Cancer Society, but I know that we need preventive care, we need health care, and we need to have a way that we are not just turning over our tax dollars to private health insurance companies. So thank you very much for this.
Thank you.
Congressman, I am a cancer patient, and so I want to talk about affordability somewhat for us as individuals. I happen to have good health insurance, but I meet a lot of people that don't, and even with my health insurance, for instance, the co-pays can be a big issue. For instance, last December, I had in a 21-day period, 28 appointments. And so co-payments really can add up, plus just the cost of going there. I mean, it's 20 miles one way to my provider. So my concern is for us individuals, for the people, what it would cost out of pocket for us. And I guess my question to you is, what percentage of our annual income do you think is a reliable amount for us to have to pay out for our care?
Let me say this. Even if I had an idea of the answer, I don't know that I would say it. Honestly, I don't know the answer to that. That's a very, very good question. And I can tell you it's one that we'll talk about and we will kick around a little bit in our office because I think that's a very good question. I've never asked that. And I think, I don't know that I would be I think, you know, all of you would be the better, you know, the better guide to that. One of the things that I do find interesting, though, is this, is that, you know, people always talk about what their insurance premiums are and how they have risen over the past several years, and, you know, obviously what they anticipate them to be in the future. And that's the reason we're doing healthcare reform, because this is unsustainable where we're going. Where we are is, you can argue, sustainable, but clearly where we're going is unsustainable. And, you know, I think if people thought about it in terms of, that's a tax, you know? Your insurance premium is every bit as much a tax on you as anything else. The difference, arguably, being you get to pick your doctor, you get to pick your health care, you get to pick the kind of insurance that you want, or choose not to have it, which some people choose. But I think, you know, we need to think about it in that way. And if you think about that as a tax, you really have no, I mean, you can arguably say, if I raise your taxes, you can vote me out. But if your insurance premium, you know, goes up, you can try to find another insurance company, but chances are you're gonna pay. And you have a pre-existing condition, exactly, which I can tell you the one thing that I think that most everyone agrees on is we need to change the pre-existing condition component. It has to change. That's good for individuals. It's good for business, because business people tell me all the time, we can't hire anybody new. You know, we've lost a good employee because they don't want to leave their present insurer or their present employer because they'll lose their insurance, and, you know. So obviously that's why we're doing this. I can tell you, if you know, I don't have an answer on the percentage, but we'll be kicking that around a little bit, and I'll be certainly throwing that out at a few other town hall meetings to people. But there's, you know, if anyone, when they ask their question, if you want to give your opinion of what you think a reasonable amount would be, we would love to hear it.
We have the gentleman in white, and then after him, the gentleman in the check shirt.
Tim Lattimore, how are you, Congressman?
Good, Tim.
Glad to have you here today. As you know, in the 60s and 70s, the model of the U.S. health system was Rochester, New York. Had Xerox, Kodak, and Bausch & Lomb at full employment. The goose that lays the golden egg is the manufacturing sector. The more that we're non-competitive in that area is the reason why we got more and more uninsured people today. And I just hope that we can be more competitive so that we can bring the industry back. I know that your hometown and our town, I mean, we've lost manufacturer after manufacturer, and it's continuing. Carrier announced the other day that they were closing down their operation. So if you can get into the workers' comp and the other costs, especially the, I know that energy, the Business Council just came out saying that energy is 65% more in New York than it is anywhere else. I think if we attack those areas, we'll be more competitive and hopefully employ people and have employee-sponsored. I know that in the room we have academia, we have government, hospitals, and they supply health insurance to their employees. In days gone by, the manufacturing sector did the same. So I think that the unemployment or the uninsured will be a lot less if we bring back manufacturing. Thank you.
Thank you. A couple, I think, important points to make off of that. One is, first off, obviously, workers' comp is a state issue, and again, I don't want to get into the state issues. Secondly, is that with respect to the energy costs, I mean, that's why I voted no on the cap and trade bill, was because I felt that it would jack up the energy costs that we pay that are already much higher than a lot of other places. And, you know, look, on the backside of it, do I think that what it wanted to achieve was right? Absolutely. We all want a clean environment. But on the other hand, you know, New York, we pay 9.3 cents a kilowatt hour. Up here, New York City pays 21 cents a kilowatt hour, and we were just going to increase. Say nothing of the fact that no one talks about the fact that as they build more energy, they're going to need more power lines, and the power is usually produced in the western part of the state, and they ship it to the southeastern part of the state, which means it runs right through, you know, our district. So that being that. Secondly, I have a concern that you talk about employee-based health care. I don't think we should have employee-based health care, and most employers that you talk to agree that employee-based health care is where, I mean, and it started because the great employers like General Motors, like Bausch & Lomb, Kodak wanted to attract employees. They were doing well, and they started to give them insurance. Now we're stuck with a situation where we're looking to our employers and we're hitting our employers, and the employers, you know, the thing they talk to me, one of the three things they talk to me most about is healthcare. And they want some type of healthcare so they don't have to pay it, so they can be, because they say, we love our employees, we give them insurance, but we can't compete with some of the southern, you know, and some of the other, you know, businesses around the country that don't give, let alone the Japanese companies and the foreign companies that have their health care worked into their, you know, their government structure, and therefore it's hard for us to compete because we have to include $21 in the cost of every widget that we produce because of health care. So that is clearly, I mean, yeah, if we had good jobs and we did an employee base, that's great, but let's face it, we are moving to a service sector or a service-oriented economy, and it's much more, and we see people working 3 and 4 jobs. Well, they're working 3 or 4 jobs, and none of them are high-paying jobs. That's why they're working 3 or 4, and chances are they're not going to get insurance. So I think, I like your idea. I just don't know that it's practical. I think we need to move away from employee-based healthcare and move it more toward a different kind of system where the employer is not the one responsible for you know, the giving of it. I think that would be optimal. I don't know if we can do that, but that would be optimal.
The gentleman in the chat.
Thank you. Thank you for having the event. And I had 2 points that you actually brought up earlier. And one was the Blue Dog group that you're a part of, and actually the gentleman behind me raised the issue. And I've been following this debate for a while. I voted for our president, and I voted for you to enact change. I'm young enough where I understand the repercussions. I look around the room, and no offense to anybody here, but I'm going to be paying for whatever changes or what doesn't change for a little bit longer. You know, and I accept that, and I'm embarrassed that more folks, you know, closer to my demographic aren't here. But that being said, I am disappointed to hear Washington Post, July 31st, that the Blue Dog Group, because of its hesitancy, and I don't know what the correlation is, maybe the moons are in alignment, also received heaping donations for campaign dollars from the healthcare lobby. So I want to take you for your word, and I believe that you're listening to those single payer advocates as well, but I would encourage you to listen to them a little bit more forcefully and strongly than some of the big insurance companies. And I do have a little bit of knowledge in this. It's something I've worked with the county legislature on, and that is that the current system, whatever we change, needs to cap those costs. I'm fortunate enough to have pretty reasonable, great health care, certainly by many standards. But I know very well, I looked at it today, that myself and my employer, the community college here in town, pay a hefty dollar for that. And it's only going up. And I've seen it from the county perspective too, and it's not the county's fault. And I have a finger to point, and it's at big insurance. They talk about competition, and you can look at a map of the country and see where the different companies have gouged areas out where they don't have to have competition. It really works out well for them. And the other piece of that is a personal story. You mentioned one of those. My wife and I are young, we're active, and try to live a healthy life. She recently had to have surgery, and because of our choice, we went to a doctor out of network. We checked everything out ahead of time. The bills came back, most everything was going well, and then the physician's bill came back. And it was a $7,000 bill. We received a reimbursement for $100. Yeah, it's a little shocking. Called the insurance company. They said, well, we're not sure. There's not a code. We'll get back to you. So the Attorney General's office is aware of it. But what I'd like to say that on that note is that the way the system runs right now is there's nobody checking that off. And I'm not an expert in insurance, but I'm aware of if I get in a car accident, a third party person comes out and says it's going to cost this much to fix, and your insurance company has to pay this. Not the case with health insurance. No checks, no oversight. And you can look at demographic maps going back to 1996 or so in New York State when the legislature and state government said, okay, you can raise your rates as long as you give everybody the same insurance and you're not withholding plans or people and disproportionately serving the public. Great. Well, I think it was anything under 10% would go. And you could do that on a yearly basis. Well, sure enough, I mean, if you look year by year from that point on, the premiums have gone through the roof, and that's when it's become a burden to county agencies, to Q County. I mean, it's a bit overburdened right now, and I don't see any help in the future unless something like this comes in. And I fully accept the fact that it may be imperfect, but I would urge you to make an attempt. Don't vote something down because it might be wrong, because what we have is definitely wrong. Thanks.
You very well and very articulately pointed out a lot of the real issues for me. And I mean, I can sit there and the easiest thing in the world would be for me to vote no. I can find 1,000,001 reasons. But the stories, the individual stories are the reasons that you vote yes. You talked about insurance company competition. This is one of the fallacies the insurance companies pass around. They say, there's 8,300 insurance companies offering insurance. Well, what they don't tell you is most of them are confined to particular areas. So that, they are monopolies or 2 or 3 companies in an area. So it's not really competition. And obviously what we're trying to do is promote competition. With respect to the Blue Dogs, I can tell you that the biggest issue for the Blue Dogs is fiscal responsibility, is how we're going to pay for it. One of the things that I feel extremely strongly about, this has to be deficit neutral. And I can tell you one thing, that I don't care how good the bill is, if it's not deficit neutral, that is, if we're borrowing into the future, I'm not going to support it. No bill is, the president has already assured us that that's a no-brainer. I mean, everybody's pretty much on board with that one. But there are some of the things, that we are concerned about. I mean, we need to do it. I agree. We just want to make sure that, we can afford it, and that it happens, it's done that it achieves what we want it to achieve. But thank you.
Just to save you from running back and forth, we have 2 ladies here, and then we'll come over to this gentleman here, and we'll see how we are in time.
Hi, my name is Ann Corona. I'm a patient advocate at a community-run health center here in the Auburn area, Port Byron. We are one of 2 health centers that take Medicaid. And I see both sides of the issue. What I really want to happen here today is that people not be intimidated by scare tactics. insurance lobbyists are running things exorbitantly high. People will be billed, they'll be denied. Insurance companies have people on staff just to deny, no matter what the proof is in front of them. The amount of money that it costs just for doctors and health centers to deal with this on a daily basis. They have employees that are overburdened, overworked, and it's pretty black and white to me. People need health care. There's a few people that are lobbying Congress that are making tons and tons of money, and people are suffering. And I just don't want people to have the wool pulled over their eyes that, oh, you know, government's going to come in and it's going to be terrible, because it's horrible now. And I have people that are very sick, and they're trying hard. They've worked hard all their lives, and they don't make great money. And you know, they've lost their home, can't pay their heating bills. So I just want to let everybody know, don't be intimidated. More competition in my eyes is healthier. Nobody wants government to take over anything, but having another, I kind of look at this as being like a watchdog. It'll keep costs down, hopefully. You know, the government will be working more for the people, and it's just not going to be a private few. You know, huge corporations. If you look at any big city, what's the biggest, tallest, newest building? It's an insurance building. So just please be educated and really look and see what people around you are dealing with, because it's not, this isn't government, in my opinion. It's just people needing health care, and President Obama saw that. And so if the lobbying can be taken out of it, and people can do the right thing, I think everybody can make out in the long run. Thank you.
Thank you. I just want to say, if healthcare reform is a battle, you clearly are on the front lines, because you know you do the real work every day. You see it probably better. You probably have more day-to-day anecdotal and real information than anybody here. So I thank you for your comments, and clearly that's what it's all about. It's about I look at it this way. I'm so tired of hearing this. It's a right. No, it's a privilege. It's a right. I don't think it's either. I think it's a priority. It's a priority for any community to give the people. And, I think it needs to be a priority, and obviously that's why we're here right now. So I hope we can do it the right way. So thank you.
I'm Kate Lacey, and I don't pretend to be objective about any of this. I supported the congressman, and I support the president when it comes to changing the healthcare system. And I think that it's nice to say let's take the politics out of it, but essentially this ends up being a kind of political decision. And it bothers me when I look at the arguments back and forth to hear so many people saying the government can't run anything, the government can't do this, we don't want bureaucrats making our health care decisions. And the two most popular programs in this country are Medicare and Social Security. And you can't touch them politically. They are so popular. And they were passed on very partisan choices and very political choices. So essentially, we really are looking at different ways of delivering services. It is basically about health care. And personally, I hear all these people who are uncomfortable with having a government bureaucrat make health care decisions. I am more uncomfortable having an insurance bureaucrat make health care decisions. At least the government bureaucrat is hired for delivery of the health care. The insurance bureaucrat is hired for delivery of a profit. And when people are being paid to deny benefits, people are just as a matter of course going to be denied necessary and deserved benefits. And I think that we need to be as skeptical of insurance bureaucrats as we are of government ones.
And the reason I'm smiling is you would be happy to hear this. I don't know about everybody else in the audience, but in one of my meetings recently with one of the insurance companies, they were going on and on about how the last, and I kid you not, the last thing we need are government bureaucrats making decisions on healthcare. And I said, well, wait a minute, I'm out there a lot, and I hear people don't want insurance company bureaucrats making these decisions because you're just as bad. So you better take half of the blame, you know, just like us in government. So I think that's a valid point.
Sir?
I don't need a microphone, I don't think. If you can't hear me, I'll speak louder. But first, I want to thank Eric, because I do appreciate the money you're going to pay for us. Thank you. I just want to make that clear. You know, I guess, you know, what I wanted to say echoes what a number of people have said. And you know, I'm partisan too. I think we're all partisan in this debate. But the important thing we need to be partisan for is the facts that we've heard. 43 million Americans have no health coverage. Tens of millions of other Americans have inadequate health coverage. People like Colleen are going without. These are the facts. The system isn't working. You know, you can talk about competition and we need to do this. It hasn't worked. There's no reason to think that with a little tweaking, all of a sudden, the government, non-government intervention is going to result in a different outcome. You know, I think it was Einstein who said that insanity is doing the same thing over and over again and expecting a different result. We shouldn't be insane. We can't be insane. One of the things, I agree with a couple of things you said. I didn't know until today. One is I'm so glad to hear that you're for a public option, because I think I agree with what a couple of people have said. And without that, it's going to be regulation for no change. And so that's really encouraging to me. I also agree with what you said, that we can't force anyone to give up their insurance. I think that's, for no other reason, that's a political requirement. I like my insurance. I don't want to give it up either. I think these are two very, very important things. But at the same time, I come back to the fact that we have to make a commitment to insure all Americans. I do have good insurance, and I know lots of people who do. I know people that don't. But everyone has to be included. It's no different than many of the other things we look at in life. Inclusion is important. Whether it's a right, it's a privilege, it's got to be done. We absolutely have to include everyone in what we do. And I guess the final thing that we'd say is that people talk about the complexity of the bill and the enforcement and so on. My observation on that are a couple of things. One is if you talk about complexity, I don't know how many people here have actually ever read their insurance policy. That's complexity. And so it's like, don't talk to me about complexity. We can argue about these specifics. This part we don't like, that part we don't like. But I come back to echo what Eric said, I think. It was Eric. But someone said that. And that is that we elected you and we elected President Obama to make a change. We look to you to make that change. If you're committed to insuring everyone, if you're committed to a public option, if you're committed to choice, then I'm committed to you. And I have confidence in you and confidence in the final result.
We can take one more question, and the lady in pink has been waiting patiently. Hi. And this is unfortunately the last.
My name is Connie Mortar, and I coordinate the outreach program for Child Plus, Family Health Plus, and Medicaid here in Cuba County. And I got to tell you, every single day I hear Colleen's story. And sometimes I send them to the Cancer Society praying that they can help them. But Child Health Plus, every child in New York State is eligible. It's great coverage. I took my kid off of it because we got insurance coverage through my husband's employer and thought, why did I do that? That was such good coverage. The only way you don't get your child can't get covered is if you have New York State coverage already, or if they're eligible for Medicaid, then we have to enroll those children in Medicaid. And we continually have families come in and we say, well, we can help your children under 19, but we can't help you. We can't help your college student that just graduated, doesn't have a job yet, and 3 months later, they're without health insurance. Every day we get a college student in there. Every day we get unemployment. Unemployment, unemployment, unemployment. These are hardworking people. They're coming in with their heads down. And we have to spend a half hour just convincing them that it's okay that, you know, they're coming to us for help. No sooner do we find out they have unemployment and they're $10 over the health insurance premiums or costs, so we have to send them away, and it's heartbreaking to see that. And I hope that, you know, what we have now isn't working, but you know, Child Health Plus is. You know, I mean, I know that they talked about looking at that, anybody that has Child Health Plus, anybody that works with Child Health Plus, they get a card, it's Blue Cross Blue Shield, it's Fidelis, it's United Healthcare. You know, those programs are working. Doctors are taking it, and the kids are getting good coverage. We need to cover our adults. We need to take care of our college students coming out of college that are losing their insurance. So I look to you to go and vote. Thank you.
I just want to say, you know, thank you very, very much. I've had, I don't know, 4 or 5 of these, and this, without a doubt, was not only, I think, the best, but the most informative. I want to thank you very much for sharing your thoughts, your stories. I know it's not always easy to stand up and share your stories, but I can honestly tell you this was extremely helpful to me, and I really appreciate all of you taking the time to be here and share your stories and your thoughts with me. Thank you.